Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and Lene.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
Did you know that tucked away inside your brain is a tiny organ that controls everything from your emotions to how you sleep and produce energy to your hormones and immune function? It even controls your weight, appetite, heart rate, blood pressure, and has the power to direct your social and sexual behaviors. It's called your hypothalamus, and it's what we're going to be talking about today on the Your Infinite Health podcast with Deborah Maragopoulos, who is a FNP. Let's get to it. All right, Deborah, thank you so much for coming on and sharing your wisdom with our listeners. I really appreciate it.
You're very welcome.
Absolutely. Looking forward to some great information.
So tell the listener how you became the woman that you are today. Like, what got you into medicine, healthcare, and then specifically what helped you zero in on the hypothalamus?
Well, I got into healthcare because I've always loved healing. I mean, as a little girl, I kind of had like the healing touch and would heal my, parents and animals. And I sutured my first animal when I was like 13 years old. My horse ran through a barbed wire fence and set a baby goat's leg and, ran a hose down one of our steers who had colic. And so I just basically had the touch. And so I knew I was going to go into medicine. I thought veterinarian, but then I decided I wanted to work with humans. Decided to become a nurse practitioner because I also wanted to have a family. And I didn't know any, female doctors that even got married or started having their family until they were in the late 30s and 40s. And when you're 18 years old, that's like so old,
All right.
So I, went into nursing school, became a nurse practitioner. The reason I got into hormones, though, is because I gave birth in 1984 to an intersex child. And so I had to learn hormones right out of nursing school before I even became a nurse practitioner in order to help my child navigate the system, the medical system. They were pretty stuck with, there's only one way to do things. And my intuition was telling me they were wrong. And since then, my intuition was right and they were wrong. And so I had to really learn hormones, receptor sites, and that eventually led me to the master controller, which I really found out in like 1997 through 99. I had started my integrative healthcare practice, Full Circle Family Health. And I started seeing just really sick people. They were coming to me kind of train wrecks. Not that I didn't ask for it. I asked the universe to send me everybody they could that would teach me about neuro-immune endocrinology and the connection. And I was sending them out with, supplements and diets and lifestyle changes, trying to get them off more, conventional medications. But they were still taking a lot of stuff. And I felt like I wasn't getting to the root of their issue. They were, mostly middle-aged, but not always. Mostly, a lot of them were overweight. They were fatigued. They were depressed. They were anxious. They couldn't sleep. And they were on multiple medications. They had adrenal insufficiency. They were hypothyroid. Lots of things going on. And I ended up getting this. I couldn't find the root. So I ended up getting this magazine in my office, just kind of landed in my lap, Scientific America. And it was about fat white mice. And mice had all the symptoms my patients did. So they had sacrificed the mice and found out that a hormone in the hypothalamus called pro-opiomelanocortin was not functioning normally. And I'm like, oh my God.
That's a mouthful.
We'll call it POMC.
Okay.
So that started my journey into the research into the hypothalamus and how to actually heal it.
Very cool. Very cool. Yeah, I would say most people have that issue, wouldn't you?
Oh, yeah.
So why?
Hypothalamus.
Right. Yeah, but I think most people are just living with a suboptimal hypothalamus and blowing it off as natural aging.
Yep. Aging actually starts in the hypothalamus. It does not start in our peripheral cells. So there's something called hypothalamic microinflammation, and we know inflammation is bad everywhere, but when it's in your hypothalamus, aging becomes very rapid. It really dysregulates your metabolism. So you start gaining weight or you don't metabolize proteins and fats properly, so you can't rejuvenate tissues. It's pretty critical. And the hypothalamus controls all of your hormones, your neurotransmitters, your immune system. It's such a critical gland and it's kind of ignored in medicine
Why is that?
because we don't sacrifice humans to look at their hormone, their hypothalamic hormones.
Well, we don't sacrifice. So is that something you can't do that on a cadaver?
Well, we actually need to see it live, to be honest. So most of the studies we have done in the hypothalamus have been on animals. And then we can do some MRI studies to actually look at where it lights up when we're actually stimulating peripheral hormones and things like that to try to figure out what's happening in the hypothalamus after we've already figured out in the mouse and the mice and rats and other lab animals. But it really is, we can't measure in the clinical setting the hormones the hypothalamus makes. So you can only measure the hormones that are secreted by the endocrine glands that the hypothalamus is controlling. And so you got to put the picture together like a medical detective in order to say, hey, this isn't just hypothyroidism. This is central hypothyroidism. It's caused by hypothalamic dysfunction. Or this isn't just adrenal insufficiency. It is central adrenal insufficiency, which is 80% of the cases. Only 20% are from the adrenals. That's actually causing the dysfunction. It's the hypothalamus that's dysfunctional that's causing the low levels of cortisol.
And it's the half-life of those hormones and the neuromediators that are coming out that they're so short that it really prevents us from actually being able to measure them. That's critical.
Yeah. Well, they're
absolutely
very tissue related. I mean, we know that peripheral tissues actually create some of these neuropeptides that the hypothalamus creates, but they're so tissue oriented that can't really measure it from the bloodstream. So we know, for instance, there's, cortico-releasing hormone is actually in the pancreas, in the beta cells, but you're not going to see it in the bloodstream.
Right. So, so very challenging. So what led you actually was there a specific endocrine dysfunction initially that actually led you into kind of delving further and further and further into the hypothalamus?
Well, it was a combination. It wasn't one specific. It was a combination of seeing these patients who were subclinically hypothyroid. They had subclinical adrenal insufficiency. So they weren't Addison's, but they definitely had insufficiency. They had insomnia. Their circadian rhythms were messed up. They usually had gut disorders, a lot of intestinal dysbiosis, obesity that wasn't responding to diet and exercise. And at the time, whatever medications we could give them then, most of the obesity drugs now are all hypothalamic targeted now that we know that it's the issue. So seeing those patients with the multiple different issues, and they had pain syndromes, trigger point pain, they had peripheral neuropathies, they had learning disabilities, mood disorders, led me to investigate, what exactly is the hypothalamus doing and how is it responsible or at the root of some of these issues? And in every single case, I could find it at the root of their individual issues and their issues together and how it corresponded in each nuclei. And I thought, my gosh, we really need to focus on this gland. It is literally keeping us alive.
Well, I find this fascinating, your interest fascinating, because, I'm kind of the typical clinician historically doing medical oncology. And, my focus was never so centrally mediated. It was much more on the peripheral disasters that were happening. But please elucidate more. This is fascinating to me.
Well, part of my impetus was when I was sending people out with these huge recommendations of like supplements and lifestyle changes. And I really like to do for my patients what I would do for myself or my family. And I surely couldn't have done what I was asking them to do. And so I was really trying to find a way to simplify it. If I could actually focus on the root issue, then maybe I could simplify all of these symptomatic treatments. Maybe they wouldn't need all these symptomatic treatments. Maybe I could get them off hormones.
Even better.
That was a big deal. So one of the cases that I saw that really like cinched it for me was a woman who had panhypopituitarism. Okay. So basically that means her pituitary gland wasn't making any of the releasing factors, no, thyroid stimulating hormone, no ACTH, wasn't making FSH and LH. So when she came to me, she was on synthetic, cortisone. She was on insulin. She was on thyroid replacement therapy. She was taking basically estrogen and progestins to regulate her menstrual cycle. She had never had menarche. She never went through her periods. She was a young woman in her early 30s when she came to see me, and she wanted to change everything to natural. So I was getting into bioidenticals. So I switched everything to bioidenticals and
Hmm.
also gave her some supplements that would help her sleep and her anxiety. And then after about 2 or 3 years, I had actually developed a hypothalamic nutraceutical to actually heal the hypothalamus. So I said to her, what if we try this and see if we're getting at the root of the issue? And sure enough, within 18 months, I was able to wean her off all of the hormones she had been taking. She started having periods. I sat her down and said, listen, at this point, now this was a long time I was working with her. So at this point, she's about 39, 40 years old. And I said to her, do you want to have a child? She said, I've been infertile all my life. I'm like, you're not now. And if you don't want to have a child, we need to think about some kind of barrier contraceptive. And she just laughed at me and had a baby at the age of 42.
There you
Healthy
go.
baby.
Yep.
So
Awesome.
So I know I've seen it so much in my practice over like 25 years of healing the hypothalamus, things shifting and changing where people are able to, get off of their hormones and get off of antihypertensives and get off antidepressants. And that whole chemistry starts to shift. It doesn't happen overnight. It's a long healing process. I usually estimate it at least 90 days to fix the hypothalamic axis.
Mhm.
And then another month per year, they've been out of balance. And that usually the time that everything kind of gets settled. So for her, it had been about 18 years that she'd been out of balance since puberty when we started this whole process.
Oh, so it took over a year to get her.
Yeah, like a year and a half.
So you're measuring the success of the treatment by the elimination of symptoms?
Elimination of symptoms and also the
need for
ability to try to wean
pharmacologics.
them off of any kind of chemicals that are basically functioning for them. Thyroid hormone. Yeah, they're able to make their own thyroid hormone.
I have
Now, if they've had a
so
thyroidectomy or we've, radiated it with radioactive iodine, no. But
Nope. That's a great question because I have so many people that are suboptimal thyroid, and there's always a tweak that's needed. I can't keep their metabolisms in the right range, and then so I have to supplement that. And I imagine that with some sort of hypothalamic stimulation or correction, that those might resolve. And I have a few patients that, I'd really like to get off this this thyroid hormone, whatever it might be, that's that I'm having to use to optimize my metabolism there. Any suggestions there?
Well, what I find is with my subclinical hypothyroid patients, they come in and they're on the medication, thyroid replacement therapy, and their blood work looks fine, but they still don't feel fine. They're still tired.
Exactly.
They're still constipated. They still don't have a nice head of hair. They still have thin outer third of their eyebrow. Their skin is dry. They have all the symptoms, but their blood work looks fine. And so I tell them if we can focus on treating the hypothalamus, and I use a nutraceutical I developed, and start feeding it, we will eventually be able to wean you off of this thyroid hormone. And it's a very slow process. I may, do 90 days of the hypothalamic nutraceutical, and then maybe 1 day a week, give them a break from the thyroid hormone, start cutting the dose down. It may take 6 or 8 months to completely cut them down. But what we're doing is we're actually increasing thyroid hormone receptor site receptivity. It's more active at the hypothalamic level, as well as the pituitary and the rest of the peripheral tissues, which is really key to actually revving up their metabolism. Now, they'll feel better within the first 6 to 8 weeks. They're going to notice a difference. But really, to wean them off and really get that thyroid functioning again, we need to control lots of factors, including like if they've got Hashimoto's, TPO antibodies, which also can be reduced with hypothalamic support.
Yeah. So excellent. So what's this nutraceutical?
So the nutraceutical I created is called Genesis Gold, and it is a full foundation nutraceutical that basically includes, at the heart of it is the sacred 7 amino acids. So these are the hypothalamic amino acids that actually correct the hypothalamic imbalance. And then Genesis also has quite a bit of sea vegetation and ancient sprouted grains and different botanicals. All the stuff I was giving to my patients in, bags and bags of stuff, I put it in kind of microdosing into the formula to provide a foundational support. So I use it for, the acutely ill, the chronically ill, and then I've had patients who've been on it for over 20 years, and it's kept us
phenomenal.
healthy.
Is that a capsule? Because I saw it was in a bag. Are they capsules?
A powder. It's a powder. And it's 4 grams per 50 pounds of body weight. So I've given it to children.
Put that in your coffee?
Do you have it with coffee?
Or no, I was asking if you could put it in your coffee.
No, because amino acids are destroyed by the heat. So you want to make sure that the water is either cool or room temperature,
Oh,
and wait about 15 minutes before you put that hot drink in there and destroy those amino acids.
okay. Okay. Yeah. Okay. So, and then how can somebody get their hands on that?
Well, when they go to my website, genesisgold.com, I have lots of information about it, plus a lot of blog posts and YouTube videos about the hypothalamus and pretty much anything they can be suffering from. I've written some kind of article about it. So, and we'll get you
Cool.
guys links for everything too.
Yeah. Please
Awesome.
do.
Yeah.
Another. Oh, is there like an age restriction? Like, do you have women in their 70s and 80s who aren't candidates for that, or are they?
Absolutely. I have people who have taken it into their 90s up till their deathbed, of natural causes. And I have women who get pregnant on it. It's really effective with PCOS patients who have infertility. Though I literally have not done any infertility work in 20 years. And that was one of my specialties since I've been balancing the hypothalamus. So they'll get pregnant within 3 to 6 months, and they've been able to take it through pregnancy. It's improved, the rates of decreased gestational diabetes, hypertension in pregnancy. So they've actually, they've even used it during breastfeeding. So we've started very young children, as young as 3, on hypothalamic support when they have ADHD or if they've had brain trauma, autism. So that was actually the reason it's in a powder form, is because the biggest group of people that I was using, besides those middle-aged people that look like the chubby white mice, were a bunch of children that had learning disabilities of undetermined origin. And this was before we had the autism spectrum disorder as part of our diagnosis. And my feeling was their brains, their hypothalamus was not being fed. And that if we could correct whatever damage was done either intranatally or perinatally, then we could actually wake up those brains, and it works.
What's the most amazing case that you've seen with respect to an autistic child?
Well, I had a little child who was about 6 years old who was, again, we didn't have the word autism, but was nonverbal. And within about 3 weeks of starting taking the Genesis Gold, they mixed it in. Little kids, we want to mix it in a little something like applesauce. At the time, we didn't have it flavored at all. It tasted like swamp water. So,
ouch.
Yeah, so we would mix it in like applesauce or yogurt or something for them. Within 3 weeks, he started talking.
Wow.
He started talking. So it was like he just lit up, and his brain was functioning. So yeah, so I do believe that a lot of brain trauma, especially in children, lack of blood flow perinatally or during the labor process, or just not enough nutrition in pregnancy or afterwards, can actually be corrected and give those kids a head start. And this was an older child. I mean, we were talking 6 years old. Start him younger, you're going to get a lot better brain healing.
He was 6 and he was not talking?
Yeah, so he was at this time we would call him a nonverbal autistic child. At the time, they didn't know what was going on. The mother was, just wringing her hands. Nobody was helping. And I said, I think if we feed this kid's brain, we'll be able to wake up some of those learning capabilities. And it worked.
Oh, so can it make you smarter? Well, can we put it in the water system?
Yeah, just make everybody smarter. That would be great. That would be great. I mean, I don't know. We do know there is neurogenesis is something that we didn't believe before. When I was going to school, probably when you were going to school, we didn't believe the brain could rejuvenate itself. Now we know it does. And neurogenesis is part of the hypothalamus's responsibilities to stimulate neurogenesis in the central nervous system. So so I do think if there's been trauma, it's definitely, I've seen it. I've seen quite a few. In fact, that's one of the questions I ask my patients to, rule out hypothalamic dysfunction, is if they've had any head injuries. It's very, very, very common to see hypothalamic dysfunction after head injury.
So even like car wreck kind of TBI things, would it help with that?
Yeah. My equestrians, they've all had falls, those football players, anybody's getting their head banged around. And if they've had a concussion, probably for sure, but they don't necessarily have to be concussed or, have passed out to have suffered hypothalamic inflammation from the head injury.
Wow.
Yeah, that's very interesting. You might have to send me some of that because, I had brain trauma when I was a child.
That explains some things.
Yeah. Well, sometimes people don't realize it because it's kind of insidious. They hit their heads quite a few. But when I start talking about them, what other things are going on, I had a young woman in the office where it was pretty clear to me that she probably had hypothalamic dysfunction, but when I went back, she'd come in after a car accident, but I went back in her history because this wasn't the beginning of her issues, and went back to when she was prepubescent. At the age of 10, she got butted by a sheep and hit her head on a rock.
Oh my
And
God.
after that, she had hormonal issues. She had all kinds of issues with her periods and all kinds of, once she started, and everything was out of balance. And she had hyperphagia, she was eating too much. And,
Wow.
and I'm like, you had a hypothalamic dysfunction back then when you were 10. And that damage you had then, it just got reactivated by this motor vehicle accident you just had.
No.
So, and she said, I feel like I'm in puberty again. The same things are happening. I'm like, it's your hypothalamus.
Right.
Wow.
So have you, a couple of questions, I guess. A lot of, I also see a lot of adult growth hormone deficiency and
Yes.
IGF-1. Yeah. I think this is also something obviously that, GRH releasing hormones, those things are also certainly very, very prone to head trauma and those things.
Absolutely.
Interesting.
Absolutely. I mean, it's the prime therapy that I use in all of my patients that are hypogonadal or going through climacteric or the change. Anytime they're not producing the hormones they should be producing. And I always look at growth hormone production as well as part of it. I mean, I look at every gland I can measure to try to see patterns. And I do see improvements, So before I start doing any growth hormone therapy or
Right.
sex hormone replacement or start
Peptides or
feeding the
whatever.
hypothalamus
Right.
and get that base. Even before they come in as patients, I'm like, why don't you start on the product, do it for 90 days, and then let's talk. Because oftentimes we just have it, then we can really get started on whatever bioidenticals they might need. The receptor sites are more active. They're already feeling better.
Right. So the impact, even in a larger sense, and for the aging and longevity. I mean, I think the impact of these imbalances that creates kind of a whole body imbalance and toxicity and ultimately inflammation, and which propagates obviously the aging challenge. Have you looked at any serially at any of the kind of the biological aging tests, the true age or any of those things, to epigenetic age or any of those things to see if there's any impact over the long term with the use of
hypothalamic support.
Yeah.
In the rare patient who's willing to, I'm also cash-based practice, and some of this stuff is,
Right. Understood.
isn't covered. So the rare patient who has the funds to be actually come in and we do the baseline and is willing to follow it out. So, and it's not always with the same companies. It's not, oftentimes they'll come to me already having had some testing done. And so I have a baseline and we can retest them in, 6, 12, 18 months down the line and see what the changes are. So yes, we do see changes, but I don't have enough numbers to give any clinical significance because of the size of the practice.
Well, just the rectification of the hormonal balance in and of itself.
Oh, well, that's the easy part. That's the easy part.
I mean, I have an average age reversal of 10, 11 years just by optimizing hormones peripherally and not even addressing this. This is a fantastic addition. This could potentially be a fantastic addition
for a
number
it'll
of
make
patients.
it so that the hormones that you're replacing, you don't need to use quite as much.
Mm-hmm.
And, you'll be able to, cut some dosing down because the receptor site activity is even better. They just become so much better sensitized to their hormones. And if it's a gland that could still be making it, we want to supplement. We don't want to have to replace.
Exactly. And
Right?
shut it down.
Yeah, we don't
Right.
want to shut it down. So, and giving breaks, I give all of my female patients at least 72-hour breaks from their sex steroids to clear receptor sites. I do a 6-day on, 1 day off with my adrenal hormones and thyroid hormones just to wake up the HPA, HPT axis,
Gotcha.
to start to retrain the axis. So, my goal is to try to get them to heal themselves if possible. If there's any tissue left and we can wake it up, that's the goal. That's the goal. But yeah, it definitely helps in the aging process. I had, I actually had hypothalamic amenorrhea from being a runner. They used to call it runner's amenorrhea back in the day.
Right. Remember well.
So I had no periods. I started my periods, 13, and then I had anorexia. So nothing happened at all. And, it was by the grace of God that I got pregnant because I was giving progesterone to start my periods. but basically no periods. And so I was on bioidenticals myself thinking, oh my gosh, I'm a mess. And when I started taking my own product, Genesis Gold, and I stopped everything, I stopped my bioidenticals, all my supplements, just took the Genesis Gold. Within 2 months, I had my periods back. I had regular periods from the age of 39 until I was 56. I'm 63 now. Now, my sisters who are younger than I went through the change of life 10 years earlier than I did. I went through the change of life at about the same time my mother did. Now, we had the same, we're, Italian Americans, same diet, we're raised basically the same. Maybe we deal with stress a little bit differently. We're all very athletic, nobody was overweight, all have pretty similar body types, etc. And the difference was I was the only one taking hypothalamus support during this process. So I think I extended, that climacteric
fertility.
So, yeah, I definitely extended it, and it definitely affected the aging process.
Fantastic.
Yeah. So,
and you look marvelous.
Come in on perimenopausal, and they're like, oh my gosh, I don't want to do this yet. I'm like, well, we might be able to slow it down somewhat, or at least ease you through this and kind of extend these years somewhat. And it doesn't mean I'm not going to also give him like bioidentical progesterone to regulate their periods or things like that. But, just to make things a little more comfortable.
Mm-hmm.
But it just makes it a little bit easier and allows the body to, run a little bit longer on its own devices.
Yeah. Love it. Love it.
Cool.
I have patients asking me very frequently. Just this past week, a couple of patients were asking me about their thyroids. Well, and they're on small doses for optimization purposes. And this would be a really, an easy fix for those people who really desire the absence of a pharmaceutical or even a desiccated pig thyroid.
Right. Exactly.
That's kind of grossed a couple of women out. What? He's got me on pig poop? What?
Jeez.
Not what he said. So you have a book, the hypothalamus.
I have a few books, but the one you were introduced to was the Hypothalamus Handbook.
Yes. So let's talk about that.
Okay.
What is it about?
So it's basically
the title kind of gives it away, but
well, it is. It's a Hypothalamus Handbook. It's basically my attempt to educate the public, but also educate clinicians on the importance of the hypothalamus. So the way I designed it is the first part of the book is all about the hypothalamus and what it does and symptoms of hypothalamic dysfunction. The second part of the book, I have case studies, and I go in. It's like you're following me with the person who's, telling me their narrative and, and then what I see on the physical exam and what kind of blood work and testing I might do and my interpretation and then my assessment and then my therapeutic plan and then a 3, 6, 12-month follow-up. And I've got 6 different case studies, male, female. I have a transgender. I have a child in there, a couple middle-aged people, so that you can get a gist of it. And I use their diseases, their different diseases they're coming in because they're train wrecks. They're all train wrecks.
Right.
So to point out how what's the hypothalamus's role in that particular disease, whether it's an autoimmune disease, hyperprolactinemia, whatever's happening else, or their GI issues, what the hypothalamus's role in is that. So I'm using each patient to educate who's ever reading this. The next part is all of my 5 pillars of hypothalamus healing, including the nutraceutical. And then I actually have a chapter for healthcare providers, which is quick and easy. You've got your pathophysiology, your etiology, you've got your ICD-10 coding.
Oh, even better.
You've got your cheat sheets on what you're looking at with the labs, and then a humongous bibliography at the end. So I truly think that the clinicians are going to get more out of the case studies, which are written story. I want you to feel like, oh, that could be me, or that's my aunt or my kid, because that's how people learn, with that recognition. And so even though it's very clinical and you're in the clinician's chapter, most of them learn the most from the case studies.
Right.
Very cool. And where can people find your book?
It's on Amazon. They can also get it off of my website, the Hypothalamus Handbook.
Okay, cool. Well, what is one thing that you'd like the listener to know?
Well, that they really need to focus on their hypothalamus if they have any issues at all. And one thing that they can do for themselves right now that doesn't take taking my nutraceutical is they need to get some sleep and try to turn off those screens after dusk, because that's really interfering with the hypothalamus's ability to set nocturnal hormones so that everything's functioning normally and your immune system's functioning as it should be in the middle of the night, and you're not releasing too much cortisol, everything's functioning normally, you got to turn off those screens.
Very cool. Good
Okay.
advice.
Thank you.
And
You're
then where can everybody find more about you? And we'll have the links in the notes
Okay.
and everything, but where can they
Yeah.
find more about you?
They can find me on genesisgold.com. And when they get there, if they want a little more information and they're not sure about purchasing anything, that kind of stuff, I do have a free hormone reboot training, and it's based on my first book, Hormones in Harmony. Way more story-oriented, no bib, really educating, lots of pictures, educating people about their hormones and the hypothalamus. And so it gives them all the access to my diets and exercises and meditations and everything about the 5 pillars to heal the hypothalamus are in this little course, video course, basically.
Okay, cool.
And it's free.
Sweet. Freebies.
Love it.
Everybody loves the freebies. All right. Well, thank you so much for
You're
sharing all
welcome.
that. It was great. Can't wait to get
You're
my
welcome.
hands on Genesis Gold. All
Thank you
right.
for having me.
No.
Absolutely.
Wonderful.
Listener, I hope you found this educational, informational, somewhat entertaining, and until next time.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm Lene. Until next time, feel it, look it, and live it.